name is Matthew Fogg, our U.S. former Deputy U.S. Marshal, retired from U.S. Drug Enforcement Administration. At this time, we'll call Dr. Thomas Kline, MD, Rare Disease Specialist and Researcher. Dr. Kline, you can speak from down there if you like.
Yes, I'm a primary care physician. I'm not attached to anything. I don't get money from drug companies. I'm not looking for grants. I just have a primary care practice. And I target people, my patients are people with chronic disease. So I see lots and lots of people with long-term disease. Some need pain medicine, some not. You need to understand that the match that lit this forest fire was the assumption that doctors are prescribing too much medicine and it is leading to more overdose deaths. That's not true. The reason it's not true is the number of prescriptions we write in the United States is governed by the DEA. The DEA only allows us to write a single prescription and no refills. In Canada, if I write a prescription for a pain medicine, I put down refill times 3. That's 1 prescription. In the US, there's 3. That's why we have more prescriptions written. Period. Now, what about all this death rate? The word, the adjective that's always left off, overdose death. That sounds like what, Marilyn Monroe, overdose death? The adjective that's always left off is street overdose deaths. These are people dying in the streets. These are not people dying in communities. 95% of people who are dying in the streets are dying from multiple drugs and alcohol. The CDC takes a person who comes in with an autopsy and they have alcohol, cocaine, and a prescription opiate. Guess what? Those are 3 different deaths. So when the CDC reports that there are this many prescription drug deaths, it does not tell you that they were only involved. If a person comes to autopsy and they got 5 drugs in their body, nobody knows what they died from. The CDC just took back its death rates. Everybody knows that, right? All right, been cut in half. So what's the impact of the original argument? We write too many prescriptions and we cause too many deaths. Both those statistics are wrong. So what we have is an epidemic of ignorance and fear. In this country, the government and the politicians and the general population are afraid of opium products because it goes back a long way with morals and blah, blah, blah. So I'm going to stop for a minute, and because all you staffers are here, I'm just, a doctor. I'm not trying to pass legislation. I'm just telling you what the story is. And it is really bad out there. This forest fire has ruined healthcare. There are 6 to 7 million people in this country. That's about 2% of your populations, by the way, in each one of your states, who have no doctor to take care of them for their rare chronic diseases. People who have long-term diseases have rare diseases, real diseases, arachnoiditis, Ehlers-Danlos syndrome, complex regional pain disease. These are diseases most doctors don't even know about. So the doctors have bought into the fact that, oh my God, we're writing too many prescriptions and causing these people to die. We just better back off. So check the logic out, even if their statistics were correct. If I prescribe too many pills to people, how is that affecting people dropping dead in the streets? It's not. And Jonelle is with us today we're both from North Carolina, and she is a pain patient, and I thought if you staffers want to ask questions of either myself from a medical standpoint or Jonelle Elgaway from the standpoint of a person with CRPS, what I just said, complex regional pain, shoot, feel free. We're here for you.
Dr. Kline, can you clarify something for me? How is it that the CDC would report deaths from opioid overdose? They make 50 mistakes on the reporting, leading to a lie that doctors are responsible for all these deaths, when the CDC admitted 2 weeks ago that they didn't tell the truth?
Well, I have no idea.
They reported and blame us. Well, not us.
Yeah, they said their algorithm was wrong. They got the algorithm wrong.
And I would like these congressional staffers to please take back to your bosses. How is it the CDC can make a 50% mistake in the reporting of deaths blamed on doctors for opioid overdoses? You need to investigate them. Clap, come on.
Dr. Myers and Dr. Kline, they actually admitted it in December 29th of 2016, again in 17, and again in
50% of the deaths they blame on doctors' prescriptions, they admitted they were in error.
Okay, when the CDC steps out of line, they are not the regulatory agency to be making any comments about prescription drugs. That's only the FDA. The FDA turned down all of the tenets that the guidelines are based on. Turned them down with their scientific review. The CDC went ahead under the director, Thomas Frieden, who publicly stated that pain pills were nothing more than heroin pills. And I don't know why they did it, but that's why we're here. I think one of the finest democratic institutions we have are the congressional hearings. And these people need to go before Congress and explain themselves. Why did you do this? Why are you making up this stuff? There's so much in there. There's so much in there that's wrong. Why are you stepping out of your regulatory bounds? So anyway, both of us are, Jonelle and myself, happy to answer more questions.
At this time, Jonelle, would you like to make a statement and let the staffers know your availability as a chronic pain patient?
Sure. My name is Jonelle Elgaway. I am 40 years old, and I've dealt with rare and painful diseases for the last 24 years. I've always loved playing sports. I was a huge adrenaline junkie. I won a spot to try out for the Junior Olympics for field hockey. And a week before tryouts, everything was almost taken away. As I drove home from softball practice, I was rear-ended by a truck going 55 miles an hour. I was life-flighted to a hospital and found out I broke my C3, C4 vertebrae. With a lot of hard work and physical therapy, I would go on to recover, and I won a spot on the B squad in the 1996 Olympics. I also won an athletic scholarship to The Ohio State University. After college, I worked for a private law enforcement firm, and I owned a business flipping houses. And then in 2003, I was in another car accident. I was briefly paralyzed in my left arm and hand, and I needed emergency surgery in my neck. I would go on from then until now to have 5 total neck surgeries. I'm fused from my C3 to C7. I have 4 rods in my C6-7, and I had a laminectomy.
Wow.
I have degenerative disc disease, Raynaud's disease, PTSD, complex regional pain syndrome, fibromyalgia, and most recently, tachycardia. I cannot have children because of my disabilities. I'm a perfect example of someone that is overall healthy despite my neck issues and my diseases, and how the body reacts to someone with long-term out-of-control pain. 2 years ago, I was lowered off 2/3 of my medications, my pain medication. I was on these medications for 15 years. I started having blackouts, constant flare-ups, out-of-control pain, and then I started having tachycardia. I have an internet talk show also, and my health got so bad that I wasn't able to work anymore because I couldn't, my memory was terrible, I was bedridden. I had a heart monitor for 24 hours on, and while I was sleeping at 3 a.m., my heart rate went from 60 to 150. And I could have had a sudden heart attack or stroke. My primary care doctor and my cardiologist both said that I needed to find a way to get my pain under control, but they didn't want to do anything for it. My pain management doctor wanted to continue with the treatments and medications that were not working. And I consider myself extremely lucky because I was able to find a rare disease specialist, and he decided to put me back on my pain medication that I was previously on. Within 8 weeks, my tachycardia was almost non-existent. My blackouts rarely happen now. My memory is back. I can wake up and be productive again. My flare-ups are less often, and I'm able to keep my pain under control for the most part. I mean, it still happens, but you know. Again, I am one of the lucky ones, which is why I'm here to speak on behalf of the 26 million or so intractable pain patients. I'm here for the patients that have committed suicide. I'm here for the patients that have turned to street drugs and can possibly die because they don't know what's in these drugs. I'm here for the patients living in pure hell and agony because they have been tapered against their will or completely have taken off their medications, and now they are just miserable. These are the 3 options that the 26 million people have or are about to have if we don't get help. There are around 110 million chronic pain patients in the United States, and examples of this is like somebody with arthritis or back pain. There are 26 million of us intractable pain patients, like myself, that deal with non-cancerous painful diseases or health issues where shots, therapies, basically everything has been tried, and pain medication is a must that is able to break this, along with other treatments and medications, to have any hopes of quality of life. Did you know that today 5 to 6 million of these intractable pain patients have been completely taken off their medications or tapered due to the reductions because of the CDC guidelines? If you're concerned about overdoses and addiction, why focus on patients that have safely taken their medications for years? I've been on my medications now for 15 plus years. I am not going to overdose, and I'm not going to be an addict. There is less than 2% of addicts in the United States. This number has not changed in the last 60 years. That's under 2 million addicts within the US. Did you know that the CDC guidelines were created mainly by addiction specialists? There was not one doctor or specialist on that panel that treated or studied pain management or had dealt with rare diseases or health issues concerning pain. So listen up, policymakers. There is nothing we could do about the past, but we can work on the now. If you're concerned about overdoses and addiction, making the CDC guidelines into law, it will not work. Having the DEA raid doctors' offices and shutting them down and taking away their licenses does not work. Tapering patients off their meds and lowering them to the CDC guidelines of 90 MME, which is morphine milligram equivalent, does not work. Your current policies are creating more overdoses, your current policies are creating more street drug use, and your current policies are creating more deaths and suicides. Patients are not a one-size-fits-all. If you have a 300-pound man and a 110-pound woman and place them both on the same MMEs, that just doesn't make sense. I have a few suggestions for solutions. Number 1, lawmakers, do not create any new laws or policies with data used from the CDC. As Dr. Kline mentioned, we now know that the CDC data is flawed and manipulated. The CDC recently admitted this, that they inflated the overdose numbers, and the CDC should be held accountable, and Congress should hold a hearing so we can find out what happened and why these numbers occurred even. Number 2, the CDC guidelines should be revoked and instead use the Federation of State Medical Board guidelines. That was written by doctors and medical boards specializing in pain management. Number 3, doctors should be given reimbursements as a palliative care visit instead of an office visit. Many states now accept this, and doctors need to use the palliative care certificate and exemptions. This will allow doctors to prescribe pain medication over the CDC guidelines of 90 MME. Centers for Medicare and Medicaid, or the CMS, plan to use the CDC guidelines, which has no scientific studies supporting that the CDC's 90 MME or the CMS's 200 MME levels are dangerous and can cause overdose and addiction for intractable pain patients. The CDC proposed a scientifically unsupported threshold of opioid abuse risk at 90 MME. Again, there are no studies to support this. And in fact, the FDA scientists did a study finding out that there is no difference of pain between cancer and non-cancerous pain. Number 4, we could fund programs to help build institutions like what the VA has and institutions that are being set up all over the world right now to take care of patients properly through multidisciplinary programs. Let's be real about the limitations on alternative therapies. Hardly anyone provides them. Insurance doesn't cover them. There are no treatment plans set up to help patients if taken off their pain medications. Because I know a lot of people often say, we'll do alternative things. They're out there, but our insurance doesn't cover them. And most of us that are on disability, we can't afford those. Number 5, fund better education for physicians on long-term patient care concerning pain, rare diseases, and chronic issues. And number 6, stop trade embargo in Mexico and China until they deal with their illegal trade of illicit manufactured fentanyl. Because that's what we have right now. This is not an opioid epidemic. It may have been back in 96, 97 or whatever, but now it is an illicit manufactured fentanyl issue. And that's poison, basically. Did you know that when chronic pain patients use their medications properly, addiction is almost non-existent? Again, intractable pain patients cannot be dealt with in a one-size-fits-all manner. We are not going to suddenly become addicts, and we're not going to overdose after years of safely being on our medications. We need to let the doctors treat and prescribe for their patients how they deem fit. No one is immune to becoming sick like this, and I wouldn't wish this on my worst enemy. This could be your daughter, your son, your grandkids. This could be you. Don't we all deserve the best quality of life and to have the opportunities to receive the best levels of health care? What is currently going on does not work. This is a simple problem with a simple solution. We need to allow patients to have access to the correct medications and treatments that they need to live. There is no playbook on how to deal with life when it's suddenly turned upside down and inside out. And we just want the opportunity to live and to be a productive citizen of the United States. And I'm just asking for your help, and on behalf of the 26 million people out there, to give us the opportunity to live and to have a quality of life again. Thank you.
Supervisor, you mentioned the suicide rate. Can you briefly let the staffers here know, because we're not talking about the veterans. I want to make sure that they understand that we're losing 20 veterans a day because they can't get adequate pain treatment at the VA hospitals and clinics. Can you talk about the horrendous suicide rate now that chronic pain patients who are opioid non-abusers, veterans who are not be able to get pain treatment now in the VA hospital systems that have experienced? Can you make a comment on that before we end this memory fall?
Jonelle and I have worked on this together. We don't know how many people are killing themselves, but we do know there are 30 who have killed themselves directly as a result of having their medicines taken away from them. And these cases we have on file on Twitter, which you can access by Googling medium suicides Kline, K-L-I-N-E. Those 3 words will get you to the suicide list. We also have a new suicide coming up each month that we're adding to the list. We have a new one apparently out of Syracuse, New York, a National Football League player who had his medicines reduced and he killed himself. Very few people on the list kill themselves with opiate medications. Why? They were taken off. So they kill themselves with violent means. This is a real problem. People are trying to brush this under the carpet and say, oh, these are just anecdotal cases. What else could they be? These are not anecdotal human lives. And the other part, people like Jonelle, is ruining people's lives in general. But the suicides are a very real thing. We don't know totals because if you do commit suicide by taking pills, you're chalked up as an overdose death rather than a suicide. So, but it's happening, and it's happening every single month.
Thank you, Dr. Kline.